webinar on signing of collaboration between Atal Innovation Mission and India Sweden Healthcare Innovation Center, along with providing the details about the innovation challenge of India Sweden Healthcare Innovation Center. Thank you so much for joining in. I'm Harika Garapati, currently working as Program Manager with Business Sweden, and I'll be moderating the webinar today. For the people who are joining on YouTube live event with us, if you have any questions or comments, please feel free to drop it in the comments box. We will address all your queries at the end of the webinar. It is indeed a great evening for all of us at India Sweden Healthcare Innovation Center to have Atal Innovation Mission being one of our core partner to finally sign this collaboration with Atal Innovation Mission, and also providing the details about the innovation challenge to the wider network of Atal Innovation Mission. So thank you so much for organizing this, sir. Without any further delay, I would like to call upon Mr. Ramanan, sir, Mission Director, Atal Innovation Mission, to welcome the team also and give us the opening remarks. Over to you.
Thank you, Harika, and good evening or good afternoon to everybody who is logged on to this call from Trade Business Sweden, dignitaries from the embassy, also other members from the Atal Innovation Mission, and everyone else who has joined in related to this event. First of all, I hope everyone is healthy and hearty in these difficult circumstances, the COVID-19 circumstances, and following the safeguards that need to be practiced, advocated by your ministry, your health or authorities, or by your institution. I am really delighted, and it's always a privilege to work with Trade Business Sweden, who have been associated with Atal Innovation Mission over the last couple of years in many activities. And I want to thank Trade Business Sweden for proactively reaching out to the innovation and entrepreneurship community in India through Atal Innovation Mission, through Niti Aayog, and through the various interactions that they have with many other ministries across the country. Because this is something that is very important. As all of you are aware who are logged onto this call, the Atal Innovation Mission is focused on how do you create an ecosystem of innovation and entrepreneurship across the country. And we are doing this through several initiatives at the school level, at the university level, at the industry level, at the NGO level, at the state level, and at the national level. But none of these initiatives can really succeed unless we work closely in collaboration with multiple stakeholders in the system. And that includes international agencies, international governments, entities, multinationals which are working across the rest of the world, but who also see India as not only a market, but also a place where their solutions should find an expression in. And therefore, this innovation entrepreneurship mission embraces these partnerships in a very holistic manner. And it has been a tremendous delight for us to participate along with Trade Business Sweden in launching challenges, the Unnati challenges to begin with, in the areas of electric mobility, in the areas of healthcare. And more recently, we are also partnering with them in the Indo-Sweden Health Innovation Center that is being set up in Jodhpur. In particular, I am delighted that we are going to be signing an SoI, a statement of intent of working together in the healthcare area. But more importantly, it is not just spanning the healthcare area, but other areas, related areas that is of interest both to Sweden as well as to India. For after all, we are now becoming a nation of startups with more than 30,000 startups in the country. But these startups need encouragement through the incubators, through multinationals, through corporate partners, and through major institutions, R&D institutions, academia, government, to be able to succeed. And the future of India, as the Honorable Prime Minister in his clarion call on Atmanirbhar Bharat said, that the challenges in India are many. There are 5 pillars on which the future of India lies. And that is the pillar of demographic dividend. How do we encourage and ensure that the demographic dividend of our country is leveraged? We are a very youthful population with more than 65% of our country under 35 years old. How do we ensure that these young innovators, budding innovators, more than 150 million students from our 10,500 engineering institutions, 39,000 colleges, and 1.4 million schools, how they get the advantage of becoming innovative and exercising their creative innovative potential through entrepreneurship and through startups. The second is the pillar of infrastructure, which is required. As all of you know, we have 715 districts in our country with more than 115 which are aspirational districts. We have only 8 tier 1 cities, and there is a huge urban migration problem which needs to be tackled. Not only that, we need to ensure that there are several hubs, thousands of hubs of innovation and job creation. And therefore, it is very important that out of these 715 districts, where 115 are called as aspirational districts, where they don't have basic access to healthcare, basic access to clean drinking water and sanitation, affordable housing, waste management, or education, and where you still have 1 in 5 maternal mortality, 1 in 3 infant mortality, and 1 in 4 infant stunting. These are challenges which need to be addressed through innovations, through community innovations, as well as through national R&D efforts. And the third pillar is the pillar of technology. How can we use affordable, accessible, and available technology for the benefit of driving innovation and providing access to quality healthcare across the country? And that's possible if we leverage technology intelligently. IoT technologies, Internet of Things, 3D printing, robotics, telemedicine, cloud services, web services, artificial intelligence, big data analytics, and so on. These are all technologies which can help us create new solutions, preventive, assistive, curative solutions, not only in the healthcare sector, but also solutions which are addressing the other economic problems of our country and social problems of our country. And then the pillar of demand, because we are 1.3 billion people. So any solution that we develop in India is also a solution for a very large portion of the population. And also it is a solution for the rest of the world. And finally, the pillar of socio-economic progress. We need to be able to bridge the economic divide and the digital divide between the haves and the have-nots in our country, if we want to develop uniformly and if it has to be in a sustainable manner. So in all of these areas, there is huge opportunity for India and Sweden to collaborate in areas where Sweden brings the innovation, the skill, the scale need in India. So you combine the skill with the scale, and you have a tremendous, vibrant opportunity of innovation and entrepreneurship possible, which can bring huge dividends not only to India, but also to Sweden and to the rest of the world. So with this as a context, we are really delighted and thank Trade Business Sweden for engaging us very, very proactively in all these initiatives, and to be able and to on this particular platform today, we are very happy to announce that we'll be signing a statement of intent, which will create the platform for many initiatives to progress and to see the fruitful outcomes of. It is not just enough to launch a hackathon or a challenge. We want to see it through, that it has a real terrific impact, beneficial impact to the people, to the economy, and to the young startups who are given an opportunity to exercise their potential. So thank you so much, Harika, for giving me an opportunity to share a few thoughts on this occasion.
Thank you so much, Mr. Ramanan, and I completely agree that thank you so much for your kind words about our office and our collaboration with you, and your support in Unnati and other challenges that we have run is tremendous. And we're hoping that this will be the same way for India Sweden Healthcare Innovation Center as well. May I now request Anders Wickberg, the Trade Commissioner of Sweden to India, to speak a few words about the collaboration.
Thank you, Harika, and thank you, Mr. Ramanan, for the wise words as an introduction. I just wanted to continue on a few things of what you're saying and give some background to this collaboration. As some of you have known, this is India Sweden Healthcare Innovation Center started as a collaboration between the AIIMS in Delhi and AIIMS Jodhpur and the Swedish Trade Commissioner Office, and we did sign the memorandum of understanding and contracts here during the state visit, where we had the King and Queen down in India last December. Now this is in all manners a cooperation that we hope to go both ways, with a clear vision of providing affordable and accessible healthcare to all. But that does not only go for India. Sweden also be independent of our partners, we hope, of course, that this initiative in the end will bring solutions also in the other direction for the Swedish healthcare systems, and by all means, like you mentioned, Mr. Ramanan, the global scale as well, which we are now working on closely through our own networks, but also through the networks of some of our partners, such as AstraZeneca. Now, affordable and accessible healthcare for all is key in this challenge and collaboration. And we do that by of course, enabling a collaborative ecosystem of innovation and startups in India, and also with Swedish startups and potentially also startups from other countries. And in this respect, Atal Innovation Mission is, of course, a key collaborator and partner to us. Now, we're forming this as commonly known as a quadruple, maybe helix approach, meaning that we do realize that we need to work closely with the government, with private companies such as our key knowledge partner AstraZeneca, with civil society, and also with academia. And now we're really embracing this, and we're really happy to have the Atal Innovation Mission on board as a key partner. Now, this innovation center will, of course, identify and address challenges throughout what we call the patient journey, and various challenges in the healthcare delivery. And we hope that it will be a really collaborative approach, and that it will also based on the priorities we jointly make with our partners, that we will have concrete outcomes as soon as possible, of course. We also are starting up, of course, like I mentioned, this initiative was officially started during the state visit in December last year. And we all know the challenges that has hit us all since then, but there's a clear target to continue to expand also physically beyond the center that we're setting up in Jodhpur, of course. And again, here we are really happy to have AIMS on board to support that effort, and also to scale it eventually, potentially also beyond India, and also bring Indian startups and innovations to the world. So I just want to extend again our thank you. We look really forward to driving this together now. We're very focused on having concrete outcomes for all our partners, and also for the startups and innovators that we allow to join this collaboration. And we look forward in a not too distant future to have concrete solutions out in the market to support the vision of, again, having accessible and affordable healthcare for all, no matter where. So thank you, Harika, and thanks again, Mr. Ramanan, and looking forward.
Thank you so much, Anders, for highlighting the India-Sweden Healthcare Innovation Center and the vision that we wanted to achieve of affordable and accessible healthcare, which is Government of India's vision through innovation as a lever. And thank you, Mr. Ramanan, as well, for highlighting the points about the five key pillars that are needed in the innovation area. Thanks to the digital era, we were unable to do a physical signing of the event. But as a gesture, that on the agreeing of collaboration between Business Sweden, India Sweden Innovation Center, and Atal Innovation Mission, may I request Ramanan and Anders to give a thumbs up to give your alignment on the collaboration. Thank you so much. I would now request Mr. Amrit Hinduja, Senior Project Manager, Business Sweden, to give us a brief overview about the India-Sweden Healthcare Innovation Center.
Thank you, Harika, for that introduction. And as co-lead of the India-Sweden Innovation Center, I think this center, as Anders mentioned, was launched in December. Would we be able to have the presentation on the screen? This was launched in December during the royal visit, as Anders mentioned, and I think what is really for us, what really stands out when we go down back memory lane to that point is this photograph that you will see, because I think it's not just a photograph for us. For us, it kind of shows the commitment of both countries. Starting with our co-collaborators, the directors of both AIIMS Jodhpur and Delhi, who have partnered with us in this innovation journey, but along with and very much in the presence of high-level commitment from both the Indian ministers of health as well as the Secretary for Health from Sweden. And I think this kind of laid the stone for this kind of G2G collaboration that we have established under the India-Sweden Health MOU. The vision and mission, I think Dr. Ramanan very nicely spoke about how Innovation Act, what is the need of the innovation today in India and specifically within healthcare also. And I think our vision and mission is also a lot around India's vision and mission for healthcare, to create affordable, accessible, to bridge that gap between the have and have nots that Mr. Ramanan said, to actually kind of create that geographical access, reach out to every pocket possible. And the way we would like to do it and is kind of very much, I would say, the Indian way, but also the very Swedish way of what has kind of made Sweden a leader in innovation, which is an ecosystem of open innovation that supports ideas and entrepreneurs and startups to scale up. When you look at what we would really do and how we define innovation, within this, we call this like the pillars of innovation. And innovation is being done by many players in the industry today. And I think the way we have tried to do is to kind of take a holistic outlook by kind of understanding the healthcare challenges with experts and leaders such as AIIMS Delhi, Jodhpur, ICMR, etc., who are core partners with us, along with the knowledge partners of AstraZeneca, NASCOM, and the others. And then we have tried to define these pillars, which we feel, unless you kind of address this in an exchanged manner, you would not be able to find a perfect solution. And therefore, when we talk about the way we're going to work with innovation, we are talking not just about the technology innovation, which is kind of a lot worked on in terms of scaling up a product or a solution, but we would also bring in the angles of how do you actually adapt treatment mechanisms, protocols in a patient journey. How do you kind of adapt the hospitals of tomorrow with the best processes? What should the best clinic look like in order to adapt these technologies and new solutions? And once we have that, how do you kind of work with skilling? How do you work with business models to actually make it successful? Because very often you have great ideas, but we're not able to scale it up because the L1 tendering doesn't allow you to do it across. So how do you kind of create a conducive business model around your ideas? And then how do you kind of use the data that comes out of this to prove the success that this is creating, as well as to kind of create very evidence, science-based approach in whatever we do. And hence we believe that this holistic approach kind of will kind of end the silo approach that is there in many ways, and kind of bring together those silos together to create the best impact in healthcare delivery. So a rather holistic approach is what we are keeping in mind and have when you look at this innovation center. The word, we are called the India-Sweden Healthcare Innovation Center, which I very often say is a very misleading word in many ways, especially the word center that exists in our title, because though we are calling it a center, what we do aim to do is create an ecosystem, because at the end of the day, you cannot innovate alone. And therefore, we today, by having Atal Innovation Mission agree to partner with us, I think that's another step ahead in this kind of ecosystem thinking. And very much our ecosystem thinking is what Anders spoke about, this triple helix structure, which often is also the quadruple helix nowadays that you talk, which includes government, academia, technology or companies, and civil society. And therefore, in order to kind of guide us and kind of help us scale up the success that comes out of whatever we will do at the India-Sweden Healthcare Innovation Center, we have some core partners and a core structure put in place. At a government level, we're supported both by the government of India, the Ministry of Health, as well as the Ministry of Health and Social Affairs in Sweden, since we come under this MOU of health. We have, of course, Atal Innovation Mission, ICMR, deep knowledge in research in the country for healthcare, and leaders to kind of create new pathways in healthcare. Invest India, Agni, the Embassy of Sweden, Startup India. So very strong governmental tier to it to ensure that whatever we do gets propelled at the highest level. Academia, of course, we cannot work without experts, people who really know how to deliver healthcare and what the need is. So AIIMS Delhi and AIIMS Jodhpur are the core valuable partners. Today you will hear from Dr. Kuldeep later on, a very key pillar in our partnership, who will talk to you. And of course, the entire the technology and knowledge side with partners such as AstraZeneca and NASCOM, who in their own areas of therapies or technology will contribute towards helping the entrepreneurs and startups that we associate with to kind of scale them up and accelerate their growth. With that, I think I will hand over back to Harika. Harika, I think you're on mute.
Sorry, can you hear me now?
Yes.
Thank you so much, Amrit. And this is definitely an ecosystem where we have stakeholders from multiple organizations in order to create that larger impact. And hopefully, the startups that gets onboarded through this innovation center will also get benefited out of this ecosystem that we are creating in order to faster scale up. Now I'll request Shubhang Vikas to take us through the innovation challenge statements.
Sure. Thank you so much, Harika, and good afternoon, everyone. We'll have the presentation on the screen, right? Okay. Yes. So as my previous speakers, Mr. Ramanan, Mr. Wigberg, and my co-lead Amrit, just spoke about, the idea of healthcare being affordable, healthcare being accessible. How do we actually target and solve the on-the-ground challenges, that are being seen by the likes of Atal Innovation Mission and AIIMS Jodhpur and AIIMS Delhi? And more than challenges, another theme that came out was that we should not be innovating or creating new ways of working in silos. How do we make it more effective and more holistic so that we can have an actual on-the-ground impact? We can have an impact on the last mile, on the last person in the queue. So with all of those guiding principles, we have designed the innovation challenge to solve actual on-the-ground problems that is experienced by stakeholders across the healthcare delivery network, experienced by the doctors, the paramedics, and very, very importantly, the patients themselves. So with that in mind, the innovation challenge is modeled on these three layers or components, if you will. So with each problem statement that some of my colleagues will go through after I speak, you would see that we have included a couple of things. So the very first thing is the continuum of care or the patient life cycle, which we all understand goes from awareness to screening to diagnosis, right up to follow-up and rehabilitation. And if you look at the continuum of care, Harika, if you can go to that particular part of the presentation, we had to also kind of build a contour around as to which are those areas in the patient life cycle that we want to innovate in. And based on the expert advice that we got from AIIMS Jodhpur and with Dr. Kuldeep himself over here, with AIIMS Delhi, ICMR, with inputs from all other partners, for this year at least, we kind of discussed and decided that we will concentrate on awareness, diagnosis, screening, and treatment. These should be those four areas under which some of these challenges are designed. Now, second is technology, and as Mr. Ramanan quite eloquently listed out the need of technology like robotics and AI and cloud and web services. The idea for technology over here is not to just innovate for technology's sake, but actually use technology as a driver and enabler. And it becomes very, very essential when we talk about the accessible part of the vision, right? How do you make healthcare more accessible? It depends. How do you make the healthcare work for you at a time, at a speed, and at a place of the choosing of the end patient? So hence, technologies such as AI, of course, deep learning, IoT becomes very, very important. But having said that, even though we do have a focus on some of these technologies, but if there are entrepreneurs and innovators who are developing something on another digital platform or another technology, I think those will also be welcome. As you would go through the problem statement, again, you'll be able to see as to how your particular technology would be applicable in solving a particular solution. Third is therapy areas. While the problem statements that we have designed, the challenge itself covers all the therapy areas and all the disease areas, there is definitely a focus on NCDs. And of course, in the world that we live in right now, the so-called new normal, we cannot escape the specter of communicable diseases or COVID-19. So while among the 8 or 9 problem statements, a lot of them are focused on NCDs, but there are other problem statements that would really intrigue the minds of those who are developing something around COVID-19, for example. For example, telemedicine cuts across, right? It does not need to be for an NCD or a communicable disease itself. With that said, the idea again is, and as it has been highlighted, time and again, is that how do we create an impact? And how do we create an impact in a frugal manner? Now, India is famous for frugal innovation. So how do we create an impact by creating frugal innovative solutions, which is, of course, made in India, but not just for India, but for the world outside as well. With that, I would now call upon Jayashree to take us through the problem statements that we have created. Over to you, Jayashree.
Thank you, Shubhang, and good evening, everyone. My name is Jayashree Mapari, and I am from the market access team at AstraZeneca. I'm a core team member with the India-Sweden Innovation Project, and we'll be sharing in the next few minutes, a little bit of a deep dive in terms of the problem statements or the challenge statements that we are launching as a part of the India-Sweden Innovation Challenge. I think as a core team member, if I were to reflect upon the thought process that the entire core team has been considering over the last few months when we were deliberating about the innovation challenge, some of the key things that Shubhang alluded to, for example, that one was that the patient was to be at the center of. So patient centricity is one of the fundamental elements that the entire core team has kept in mind when designing the innovation challenge, because at the end of it, I think all it is that we are trying to do is better lives of the patients. So they remain pivotal to the entire thought process behind this. Second is data, evidence, and outcomes, because anything that gets measured gets done. And I think it's therefore extremely important that while we are considering the innovation challenge and while we are looking at solutions, data and evidence considerations needs to be fundamental to anything that we are attempting to do. So that's the other pivotal thing that the core team, has been thinking about. Last but not the least is the whole piece that Shubhang spoke about in terms of continuum of care. I think particularly for India, you take any disease segment, if you look at the entire patient journey, right from awareness, diagnosis, up to management, and even post-intervention hand-holding of the patients, I think there are significant gaps in terms of unmet needs as far as number of patients that are actually diagnosed, those that are diagnosed at the timely manner. The third is in terms of the kind of management the patients get, whether that is optimal healthcare delivery that the patients are getting for the condition that they are suffering from. Last but not the least is also from a post-intervention management standpoint and from a self-care management standpoint, there are significant unmet needs and gaps that patients have. And therefore, the third fundamental pillar that was there for us was, while we are looking at innovation, while we are looking at technology-enabled solutions, we need to ensure that we are able to address some of these gaps along the patient journey. Now, coming to the focus areas in terms of the therapy areas. Non-communicable diseases, I think we would all agree lay a significant burden on the healthcare system. And it is a fairly resource intense, it is a very investment intense kind of a disease area. And as a consequence, there is a sustained effort that is required by the healthcare delivery systems to basically ensure optimal healthcare delivery as well as optimal patient management. Therefore, the focus of the innovation challenge would be on major therapy areas under non-communicable diseases. By that, what I mean is chronic respiratory disease conditions. Oncology would be a key focus therapy area for us. The entire gamut of cardio, renal, metabolic would be an area that we would be focusing on through the innovation challenge. Also, I think more importantly, what happened was when we started working on the innovation challenge, while we were considering the whole NCD segment, the pandemic hit us. And it also forced, I think, we are all aware of the tremendous pressure we are all operating in the healthcare system, the healthcare providers, the healthcare workers in the last few months because of the pandemic. It's asked us, or it's forced us to basically change the way in which healthcare delivery is being serviced and given to patients. And therefore the innovation challenge had to keep those considerations in mind as well. So when you look at the problem statements that we have carved out here, you will see that there is a lot of reliance on solutions which are tele/digital/mobile based solutions that we are looking at, which will ultimately result in optimal delivery, effective delivery to the patients in the entire backdrop of the new normal that we are currently operating in. Just to allude in terms of the specifics that are mentioned here. So as I said, that data evidence is one of the central themes that we are considering. So we are looking for solutions that would help us to effectively work with data, effectively work in the area of real world evidence. Building on it, predictive algorithms, artificial intelligence kind of solutions will be something that will be most welcome under the innovation challenge. Secondly, as I mentioned, anything that facilitates the healthcare providers, the physicians, the healthcare workers to basically monitor the patients, to basically examine the patients on a day-to-day basis in a remote environment, but effectively will be welcome. Therefore, there is telemedicine solutions that we are looking at. We are looking at wearable devices. We are looking at point of care devices that will enable us to basically function on the lines of what I alluded to. Thirdly, to what Amrit spoke about, skill building. So while we are looking at technology for service delivery for patients, we are also looking at technology. How can that be an enabler for us to drive better awareness, drive better education of not just the patients, but also our healthcare workers, which would be another area that we would be looking for solutions on as a part of the innovation challenge. Last but not the least is the entire clinical decision-making process. I think there is a fair amount of, catalyzing that can happen, and a lot of facilitation that technology and technology-enabled solutions can do as far as aiding the entire clinical decision-making of healthcare physicians, healthcare providers is concerned, because of the sheer challenge that we have in terms of misdiagnosis, in terms of lack of awareness, in terms of people not having access, to the right diagnostic solutions. Therefore, I think the entire clinical decision-making bit, which can be aided with technology-enabled solutions, would be another area that we would look at. And I have already touched upon in terms of overall efficiency of working, as well as post-intervention monitoring of patients, be it in the cardiovascular space, be it in a post-surgery kind of a scenario, be it in terms of overall self-care management of patients with chronic conditions. So that's more or less, what the problem statements would be all about. Over to you, Shubhang.
Thank you so much, Jayashree, for the detailed and very crisp, actually, explanation. And for everyone else, we will be talking about the benefits and logistics as well. So if not everyone was if everything was not captured, we'll definitely be sharing most of this through links and where you need to apply and so on and so forth, which I'll cover just after this. Having said that, now for all my friends who are watching us through YouTube and at other places, all those young innovators and startups, so what does the India Suite innovation then offer, right? I mean, we have spoken about the idea of holistic ecosystem, so that helps in ideation, right? But if you get down to specifics, so the very first component is mentorship. While we are going to enable mentorship from our collaborators such as AIMS Jodhpur, AIMS Delhi, from Atal Innovation Missions Network, ICMR, and from the network of our knowledge partners, AstraZeneca as well. But the uniqueness of these cross-country collaborations is that our network goes beyond both the countries as well, right? With certain mentorship needs and guidance needs that that may come up, we will have the ability to connect you to the actual mentor, the actual guide who can help with a certain solution, right? So it is a very expansive program, and the modalities of it would be worked upon once we have a startup or once one of you kind of come and join us. Second, funding is extremely important, right? To kind of build your prototype or to run clinical validation trials, or in the future, kind of if you're looking to kind of scale up. And we spoke about how do you take it across India and the world. We have access to a variety of investors, both at the government side and the private side. We have already onboarded venture capitalists and PE firms who have an idea of the kind of startups that may get onboarded onto this particular platform. So we also have that covered for you. Third is we can do a lot of work in building the solution, but that definitely needs to be an avenue to showcase what we're doing. So we have created a platform to both digitally showcase your solution to a selected audience, and if time permits, or rather not if time permits, if the situation permits, we also organize conferences, right? So that will be an opportunity for you to network, to showcase, to talk about your solution, and to kind of meet a variety of different people in this particular field, and kind of which will again add to the actual solution that you're building. Global reach, we spoke about that. The Innovation Center would not only help you ideate with other innovation hubs, other institutions across the globe, apart from the ones which we have collaborated in India, but also when the time comes where you need to kind of spread or kind of commercialize, or rather scale up your solution in across the globe, we'll be there to kind of help you do that. Incubation, we are building an incubation center at the AIMS Jodhpur campus, and also at NASCOM Bangalore. And this is not just a working space, right? I think that definitely is valuable, but the value of these kind of incubation spaces is the ability to access a live patient environment, ability to access really high-tech and deep-tech labs at, say, for example, AIMS Jodhpur and IIT Jodhpur, and deep-tech labs that we have at NASCOM and a couple of other partners. So incubation is not just a working space, let me emphasize that, but it is the laboratories and the patient environment that you get to really build and test out products before you actually think about scaling up. And I spoke a little bit about networking, but as Amrit went through the partner list that we have, so that gives an idea of the kind of folks who are involved in this particular initiative. And it is very well apparent that with those kind of folks, the idea of mentorship, the idea of getting guidance, the idea of scale up, the idea of getting funding becomes a little bit easier than what it already is. So these should be the primary benefits that the India Sweden Innovation Center would provide. Now, if we go to the timelines, the logistics of the challenge itself, it's pretty straightforward. We had the good fortune of launching the Innovation Challenge last week on 11th August with all our primary partners, including Atal Innovation Mission. The last date to apply is 27th September, which is a little over a month from now. And the winners of this particular challenge will be announced on 25th October or thereabouts. And between 27th September and 25th October in this month, we'll be evaluating the applications through our expert panel, and we'll be conducting virtual and face-to-face interviews as required. So for folks who do not worry, do not need to kind of note down the notes. The organizers will, share this presentation with you, share the links of where you need to apply, and also share the actual contact people if you need to talk to us. So thank you so much for your attention, and back to you, Harika.
Thank you so much, Shubham, for taking us through the complete innovation challenge. In the interest of time, I'll now like to hand over it to Manglesh, who will be moderating the panel that we have today on the need of innovation and awareness and diagnostics. Manglesh, over to you.
Hey, thanks, Harika. Yeah, so as we hear from you what exactly the innovation challenge is all about, we have a small panel discussion to understand what we are going through and the challenges and the awareness that are needed in the healthcare ecosystem. And for that, we have eminent members, Mr. Anders Wickerberg, the Swedish Trade Commissioner of India, Mr. Ramanan, who's the Mission Director of Atal Innovation Mission, Dr. Kuldeep Singh, who's a Dean Academics and Pediatrics and HOD of Pediatrics at AIIMS Jodhpur, and Dr. Anil Kureja, who is VP Medical Affairs at AstraZeneca. Welcome, all of you. Just to understand about innovation, and as we start about speaking about innovation, Mr. Ramanan, if you could throw some light on how this innovation ecosystem in India has been evolving over the years, and what you have seen as the mission director. If you could throw some light and let us know what exactly these are.
Yeah. Thank you, Manglesh. And also, I'd like to thank Mr. Anders and all the other speakers from AstraZeneca, Shubham, and everyone else for a very, very interesting and relevant discussions that they had and the challenges that they have shared. And I would say that at this point in time, I've come from the private sector. I joined TCS in '81, been with TCS since that time to just a few years ago when I had the opportunity to start working in the government as the mission director of Atal Innovation Mission. But prior to that, for about 15 years, I was also the managing director and CEO of CMC, which was a Government of India organization. And one of the things that struck me, even as I was handling CMC, was the extraordinary product creation and innovation capability that many organizations in India had. For example, CMC had more than 80 products which were out there, which were out in the market. And it was essentially, though it was a government-owned organization, it was innovative organization. I don't know how many of you are aware, they were responsible for the Indian Railway Reservation System. They developed the Bombay Stock Exchange. They have developed the depository for India. All the computerization for biometric technology for police forces was done by them. So there has been this always this latent innovative talent for product creation in India. However, the growth of Indian IT and ITES was primarily to serve the larger multinational companies across the world, because there was a huge demand for IT services and knowledge-led services. And that has led to a burgeoning, 150, $180 billion IT ITES industry in India. But also the fact was that over the last several years until recently, we really did not have this ecosystem of innovation and entrepreneurship in our country. So many Indians, when they go abroad, they do extraordinarily well and succeed to the highest levels of eminence, whether it is in Microsoft or Google or Adobe, or you talk about various doctors in the United States, healthcare professionals, university professors, everyone. I mean, they do extraordinarily well there. They are able to realize their potential because they have the ecosystem. What I've seen in the last 4 years, or I would say in the last 5 years, is a tremendous focus on building that ecosystem of innovation in India through incubation centers. Now, today we have not just from Atal Innovation Mission, which has launched 100 plus incubators, but we also have close to about 450 incubators across the country, primarily sponsored by Government of India through DST, the Department of Science and Technology, DBT, the Department of Biotechnology. Startup India has been able to provide a huge impetus to positive policies for the startup community, so that startups are encouraged. That's why we have become a nation of startups, more than 30,000 startups. It is one of the fastest growing ecosystem for startups in our country. The other thing that has also happened in the country is an acute awareness of the problems and the solutions that are required for India in multiple areas. So while we have had this great advantage of the demographic dividend that I talked about, we also have the advantage of one of the fastest growing economies of the world. We have been growing at 6 to 8% from the economic point of view, and what we didn't have was the benefit of affordable, accessible, available, and advanced technology until, I would say, a few years ago. And that has given this tremendous flip to the startup community, because now startups are able to actually create solutions, and if they are able to get access to an environment like an incubator or a community innovation center, or through challenges that are being thrown just now along with AstraZeneca and multinationals supporting it, suddenly you have a vibrant atmosphere for creating affordable, accessible solutions to the various challenges that we have in multiple areas. And so I always say India is a country of 1 billion people with 1 million challenges. And these million challenges are 1 million opportunities for our young entrepreneurs to be able to succeed. And what I have seen in the last 3 years, as head of Atal Innovation Mission, is this tremendous exuberant interest and enthusiasm by our youngsters in the schools, in the universities, as well as in the industry, to not to consider a startup venture as a risky venture anymore. People want to get into it right from the university level, and that's the sort of atmosphere we need. Because when you're young and when you're dynamic and you're full of energy and you're full of ideas, if you do not give vent to those ideas and you do not provide the platforms to be able to create your own startup or your entrepreneurial initiative, then it suppresses you quite a bit, and then you get into the bandwagon of a job seeking mentality. You just want to go to a good job, have the comfort of it, and all your enthusiasm and your energy that is possible to get unleashed gets limited and suppressed. And so I do see a tremendous advancement in the startup arena and in the innovation arena. When I look at the challenges, we are still 22% of our country is below the poverty line. 44% of our country is agri economy based, and like I said, 715 districts. We have 4,000 towns in our country. We have only 8 tier 1 cities. So we cannot we cannot be resting on our laurels that we are one of the fastest growing economies of the world, because there is a whole bridge to be crossed for enabling each of the districts. We have 600,000 villages in our country. Now, 600,000 villages, from my point of view, should have 600,000 community innovation centers where innovations happening in every aspect, whether it is healthcare, education, deep tech mechanisms, agriculture, biotech. All of these should get implemented. There may be hubs of innovation creation, but there should be a large number of community center implementations of these innovations, so that all of these bear fruit. So I think the government is seized of this problem, and they are doing their best through various initiatives, just like Atal Innovation Mission, to address this gap and to be able to fulfill the needs of 1 billion people. But I think there is a tremendous need for a society, and as has been rightly pointed out, the quadruplex that Anders referred to, we need private sector, we need academia, we need industry, we need government, we need civil society, all coming together to address the various challenges that are there. The good news is that these challenges are indeed, solvable by very, very smart, young, dynamic innovators in our country. But we have to give them also the challenges. So that's why, for example, the Atal New India Challenges was launched to give certain direction. What are the most pressing needs our country has from a socio-economic point of view, and how do we address those? So when we launch the challenges in partnership with ministries and with partnership with corporates like AstraZeneca and other organizations, then we bring relevance to the innovation that is needed in the marketplace, and we bring the support that is needed by large organizations to be able to scale up and implement those innovations. And I'd like to just end by saying that, never has been the time more opportune than now. I think this is a very pivotal moment in our history. The COVID-19 crisis has been an eye opener. It's woken us up from what would otherwise have been sort of a comfort world that we were living in. A simple virus has paralyzed nations. It has created lockdowns. It has brought enormous grief to both lives and livelihoods across the country. And in a post-COVID-19 world, we have suddenly woken up to the realization that there are many more challenges, not just the virus challenge, but there is a climate change related problem, there are urban migration problems, there are water management and clean drinking water and sanitation problems, there are disaster management problems. All of these are problems that need urgently research and innovation to direct their efforts to. And so there is a huge opportunity. All of these challenges, like I said, are again big opportunities. The other thing that the COVID-19 has woken us up to, and I think this is a seminal moment in the history of our country, is that, just like the Y2K opportunity in year 2000 suddenly woke up the rest of the world to India's ITES capabilities. So also this COVID-19 crisis has woken us up to the fact that if you want to solve this, there are startups, thousands of startups who are ready to produce solutions. And the private industry has suddenly realized that this is a real thing, that there is a lot of innovation out there. When we launched the COVID-19 challenge, Atal Innovation Mission, along with other ministries, Department of Biotechnology, DST, and Startup India and Invest India, we found 1,500 COVID-19 preventive, assistive, and curative solutions being offered. And we shortlisted 86 of them through a very stringent selection process for support by private sector, by manufacturing companies. It was not that they wanted only money. It was not funding support alone that they wanted. They needed, many of them actually needed manufacturing support. Some of them needed testing lab support, and so on. And what we found was a tremendous surge of interest by the private sector, large corporate players, as well as institutions like TIE and Invest India and so on, who were ready to provide all of this support. So this coming together of public, private, government, academia, the quadruple X that Mr. Anders talks about, actually has happened during the COVID-19 crisis, because everyone has seen the dependency of each other on everyone. And I think this augurs tremendously well for the innovation ecosystem and the entrepreneurial ecosystem. And so I'm sure that initiatives like this will have that effect. This is a pivotal moment in our history and a turning point, I would say, or a tipping point, where all the stakeholders can come together and actively support innovation and drive entrepreneurship to a next level within our country, for not only the benefit of India, but that of Sweden and for the rest of the world.
Right, sir. Quite thoughtfully put forward. So, Anders, if we understand, hubs of innovation, Sweden has been a hub of innovation and it has been rising. What do you think has created this? What are those important points which you would like to highlight, which stature the hubs of innovation for Sweden? How does it happen?
Thank you, Manglesh. It's important to remember, of course, that Sweden has not always been an innovative country in the forefront of innovation. Less than a century ago, we were one of the poorest nations in Europe, country of farmers, and some of them emigrating to the US to find a better life. But we started building the structure which has led us to where we are today quite some time ago, and that of course includes basic needs such as education, free education for all, including university. It includes building a social security governance system that actually allows people to fail, so to say, and take risks. But despite that, of course, being an entrepreneur or being an innovator is never easy. It's not easy. And I'm in full awe of many of the young entrepreneurs and young innovators of today. Being a government employee, you're kind of in the other end of the risk-reward spectrum. But we're so happy to see that there's so many new ideas and new ventures spinning out of this today. So I think we touched upon a few success factors. I mean, of course, there are some basics. Good education for all, despite your background. A social security system which actually limits the fall should you fail. And we all know that for every success, there's multiple failures. And that needs to be allowed and embraced as well. The quadruple helix model has been talked about, and that's also a fact that I think the more we work with it as a government, the more we involve the other parts of the helix, so to say, the better we are jointly in solving some of the societal challenges of today, and specifically within healthcare that we're talking about today. I think also that the private companies or the larger companies have stepped up significantly in the last couple of years, which has really accelerated the innovation pace here in Sweden. I take an example. I sit today in Gothenburg on the west coast of Sweden, where AstraZeneca has one of their 3, I think, strategic R&D centers globally. And also running the BioVenture Hub, which is like a innovation center for healthcare on the west coast of Sweden. Then working closely with the universities here, but also with the funding agencies and other companies jointly. So we see the same for other Swedish companies like Volvo, Ericsson, ABB, etc. They're all creating their own innovation hubs or with different sectorial focus areas, which has really spurred and accelerated the innovation and pace. So that's, I think, is one thing. Then I think, as a Swedish company, you need to think global and think big from start. Sweden is, of course, if you have ambition, at least not a big enough market to gain significant volumes. We're not a nation of billions of people like India. We are a nation of 10 million people. So of course, I think it's a little bit within our DNA to think global from start.
Right.
Yeah. So I mean, that's short. And then, of course, everything else comes along. We have a good access to financing, which also is seed financing from government, etc., which is also a part that Shubhang mentioned before, is something we will work actively on within the Innovation Center in India as well.
Right, Anders. So, taking it further, as we are fighting a healthcare challenge, Dr. Kuldeep, if you could help us understand what are the gaps that still need to be addressed and which can be addressed by the innovators in the patient awareness section.
Thank you, Manglish. As Dr. Ramanan has already alluded, that most important thing which is happening nowadays is about the COVID. The COVID-19 has been a greatest teacher, which has not only given us a opportunity to reflect on our previous health facilities, but also think about the future. And also it has unearthed many of the things which are exposed, many of the deficiency in our healthcare system. And when we talk about the health and the healthcare, what we, at a tertiary care center, we start dissociating the patient from the technology. So at a higher centers, we concentrate on the technology rather than the patient. But nowadays, we have understood that patient is at the center stage, and we have to understand the problem. And there are multiple problems which the patients feel, not only in India, but in Western country also. As a recent article by NHS, they have said that there is a social prescription is needed, because the patient has not only the medical problem, but there are a lot of social problems, because they may have a certain things to harvest, they have to go for the job, they have to keep the things, look after their children also, and they may be busy in some other things. So as the medical things comes at the back foot. So they just avoid the medical treatment till it is at the end stage. So that's why this is one of the things which is very important. We have to understand the patient needs. There is a need for a study of the social circumstances. The second thing is that about the literacy. When we talk about the literacy, we still have the gap, a huge gap of literacy in the village, in the remote areas. There are tribal peoples, as Dr. Ramanan has said, that there are 115 aspirational districts. And in Rajasthan only, there are 5 aspirational districts. Sirohi is one of them, which is dominated by the tribal population. And tribal people have a different things. When we talk about the another aspirational district, Jaisalmer, they have a dhanis which are located with the distance, and here the literacy is again very low. And the second part of the literacy is the digital literacy. Unless until we have the digital literacy, we cannot think about the digital health mission also. So again, this is a good opportune time to think about these. The third is that already we know about the infrastructure deficit, and there are social factors and the behavioral factors. So we have to concentrate on the behavioral insight theory of the patient. If we can target those behavioral insight theory, and we can find out what are the things which can impact them most to take the health as the priority, not as a free service available, then we can improve the health of the society.
Right. Quite rightly, actually, the digital literacy and awareness would go hand in hand when we are actually facing such healthcare challenges. Dr. Anil Kukreja, over the years, you have been, doing a lot of work with the healthcare stakeholders. So how do you think these innovations could address the challenges of diagnosis and diagnostics? Any thoughts on those? Any pointers on those?
Yeah, first of all, at the outset, thanks Manglesh for having me here, and thanks Business Sweden and AIMS for this noble collaboration. Why I call it as a noble initiative, because this will address the healthcare challenges of millions of patients in India. And I really hope this evolves to the state where we are able to holistically provide the healthcare to Indian patients. Now, let me explain you. There is a classic mention of 5 A's in terms of challenges. One starts with awareness, which I think Dr. Kuldeep has very nicely alluded to. I'll not go into that. The second A starts for access. Now, third is absence of the skilled human manpower. The fourth A is affordability, and the fifth A is accountability. Now, these are the major challenges in the healthcare system, and which, if you deep dive on the patient journey, you actually come to know that where are those challenges. Now, during my entire 2 decades, more than 2 decades of the career as a medical professional working in the industry on the other side, I have worked very closely with the collaborations on the clinical research side with the startups. We have collaborated even with the key institutes, the academic societies, and also most importantly, even the patient associations as well. Now, most important, coming back to your example on the diagnosis, I just reminded me of one of the very inspiring collaboration with AstraZeneca has with an organization called as TRICOG. And I'll just give you a problem statement which TRICOG solved it. The problem statement is, I know all of us know about the myocardial infarction. So there is a particular type of myocardial infarction. In layman terms, it is called as heart attack. Like if you do not diagnose and provide care in the first 1 hour or first few hours, then there is a problem of a fatal accident.
Yeah.
Now, to save the lives, and there are many thousands and lakhs of people who are dying because of not able to diagnose appropriately.
Okay.
There are 2 issues which were there. One, of course, the ability to read the ECG.
Right.
That was lacking at the primary care level, and it was very freely available at the tertiary care level. There are experts available. Now, how do we solve this gap? So this gap was solved with the solution called as artificial intelligence enabled Insta ECG. Now, Insta ECG is a solution which helps you that patient wherever it is, in any nook and corner of the country, if the ECG is having this software, it collects the ECG, transfers the ECG to the cardiologist, a team of cardiologists, which is sitting centrally located, 24/7 cardiologists availability, and then immediately giving the report back to the primary care center that this is a myocardial infarction, and therefore patient needs to be immediately given the thrombolysis and also shifted to the immediate secondary or tertiary care. And we have seen this not only collaboration evolving, but also saving millions of lives. Already Goa government has implemented this solution, but most importantly, there are many other private centers it will be implemented in the form of hub and spoke model, and that models are now being transformed. So this is just one example which we can say that technology enabled intervention which provides the availability of a cardiologist to a primary care within minutes so that the patient's life can be saved. So this is just one example I wanted to quote, but there are many, many such inspiring examples which I really get inspired how technology is able to really solve the healthcare challenges on the scale, on the skill, and also on the diagnosis and the management as well.
Oh, brilliant. And rightly forward, sir. Technology is actually an enabler, and rightly used, we would be able to solve so many challenges. I know that we are exceeding time, but with the kind of experience that we have, it would be very good if we could get words of advice from all of you. So, Dr. Anil Kukreja, if you could tell us or give words of advice. So, for these healthcare stakeholders and startups, how do they succeed in the Indian environment? What should be those words of advice that you would be giving them?
I think I'm too small to give advice to all the startups, but let me put it across my perspectives, and I'm sure there are experts. Dr. Ramanan is here, who has seen so many huge, inspiring startups. But my advice to you is like if we know the problem that we need to solve and identify the right stakeholders who come along and help you solve the problem. A startup has to go through the policymakers, to go to the academia, then they have to work with the healthcare setting, particularly if it is a healthcare startup we are talking about, need access to the hospitals. And they also need to have the access to the funding as well. Now, can we have a creative ecosystem whereby they get all these at one platform? And there, I think the AIM and Agni and the Atal Innovation Mission has really done a remarkable job. And not only that, but also these incubation centers. And our effort is in that direction to be, and we are proud to be a knowledge partner of this Business Sweden and AIMS collaboration. I think this will provide, so India Sweden Healthcare Innovation Center will provide this kind of an ecosystem. So my advice to the all startups and each one of us is if we keep patient at the center, if we really know what problem we need to solve, and if we really apply the technology, there is a potential for all of us to solve these problems. And if we all come together, we will be able to address the solution in a holistic manner. There may be a need for more collaboration. So I really look forward to that kind of ecosystem being created in this. And I'm hopeful, and we are confident that India Sweden Healthcare Innovation Center will create this kind of ecosystem.
Right, sir. Thank you, Dr. Kuldeep. Dr. Kuldeep, I just wanted to understand, and if you could help us with some experience of yours of how these students and entrepreneurs should keep the patient awareness and diagnosis in focus. What should they address actually, and how should they solve the problem using the issue of patient awareness and diagnosis?
Yeah. See, for any intervention of any innovation to be successful, it should be simple and it should be acceptable by the person for which it is made. So that's why if we go for a very simple thing which can be integrated with the existing system, it will be highly acceptable by the people. And I think if we go for the screening program, which are the base of the like early diagnosis, so that we can provide the early care. So screening device should be as simple as possible. But most important thing is that they should address the common problem. That we have to understand that the disease should be prevalent, it should be potentially treatable, it should affect large portion of the population, and there should be like a system which is having a high sensitivity. So if the entrepreneurs and the students who are innovating can devise such methods for diagnosis of the common disease, then I think this will be very useful for our society, not only for India but for globally.
Right, and quite the focus of the innovation challenges that we are looking toward.
And the most important is the cost. They should be very simple and cheap and cost effective. And I think in this direction, the Sweden India Innovation Centers at Jodhpur can provide all the facility for these to be successful, because under the direct guidance of the clinicians, we have 26 departments who are having expertise, and they can guide and mentor these for producing the cost-effective equipment.
Brilliant, sir. Anders, if I could just pick your brain, and if you could let me know, what would be your words of advice for the startups and MSMEs who are attending this session or would be seeing this post maybe tomorrow or day after? What would be your words of advice for the startups and everyone, the budding entrepreneurs?
Thank you, Magnus. Yeah, I think I agree with previous speaker. I'm too small to give a concrete advice, but I think make sure to utilize all the aspects that we provide in this center and collaboration. It's not only about, of course, a physical space or the ability to connect. It's about all the services they provide. It's about, there's tremendous knowledge and tremendous networks available at your disposal. So make sure you're really indulged in all the services we can offer and make the best out of it. So I guess that would be my simple advice.
Oh, thank you. Mr. Ramanan, if you would give some advice to the healthcare startups, what should they do to face the challenges, and what should be the solutions, and how should they scale up? How would you give that and help our startups?
So I would ask them to look at the word startup, Mangesh. The S stands for, are they creating a solution that can scale and that can have an impact, and for problems that are relevant to the community, to the country, and so on. So first and foremost, you should start with looking at problems, and as the previous speaker said, the solution has to be simple. At the same time, it has to be scalable, and it should be something that societal impact is possible at scale. The second is, how are they going to leverage technology, either in the creation of the solution or in the enablement of access to that solution. The accessibility to the solution is enabled by technology. So telemedicine, cloud services, how do you leverage, all the examples that were given, how you can read an ECG by a team of experts, and how do you make that as a very agile way of being able to respond to an emergency, rather than a very complicated bureaucratic process of going to a hospital and by the time it is too late. So technology should be used and leveraged very advantageously in being able to either create and innovate to the solution, or it should be able to provide reach to the solution. The third, the A stands for affordability. In a country like India, affordability is very, very important. So if you create a solution, of course, there are some solutions which will be more costly, but even there, how do you bring the affordability aspect? And that is, again, not only leveraging process innovation, the four models that they talked about, how you're going to bring innovation in technology, how you're going to do the business modeling, how you're going to do the protocols and processes, and how you're going to use data and analytics to be able to drive affordability, right? So that's the A. The R stands for reliability. You have to, in a healthcare world, you cannot talk about a solution that works 50% of the time and doesn't work 50% of the time, which is not accurate, which is not of high quality. So bringing reliability and robustness in the solutions that you are bringing is very important. The T, again, in the startup stands for the trust factor. Any healthcare provider or any healthcare solution should be able to evoke trust, and that trust happens through tremendous amount of focus on testing, on regulatory aspects, making sure that all of those are followed. It is standardized. You're not coming up with some arbitrary solution. If you're coming up with a new solution, how do you get it certified, and so on. So the trust factor and the testing factor is very important in any healthcare solution that you do. The U stands for universal access, right? Again, how do you make it available through various mechanisms, and therefore the utility aspect of that particular solution enhances multifold, across a city, across a country, and so on. And finally, the P stands for partnerships. I think startups should see what are the partnerships they need in order to make their solution very effective and very successful. Without a strong network of partners, be it accelerators, be it the innovation health center that you're basing yourself out of, stakeholders, various other stakeholders, venture capitalists, organizations like AstraZeneca, corporates, NGOs who can play a role in education awareness and all the things that they talked about. That strong network of partnerships are required. And finally, the S stands for societal good. Many people fall prey to making money. We see the problem that very often most commonly required drugs in the market are very expensive, and but that's a prevalent problem. So while economy and commerce should always be a factor under consideration, the greater societal good is what should be enabled, because that's what healthcare is all about, making sure that we are a very healthy society with welfare and wellness of people in mind. So if you just look at the word startups, you have exactly what you need in order for the healthcare startup to focus on and to succeed.
Right. So quite brilliantly put forward. There's a quadruple helix model that could be used for partnerships, and the startup word for understanding challenges and solutions. Thank you so much, gentlemen. I think this was quite a lovely time that we spent in understanding your experiences and your point of views. And I think there may be some questions. We'll just look at them if we have some. Or Harika, I hand it over to you.
Thanks, Kamlesh. We have two questions. Primarily, one question, Shubhang, I'll ask you this question. The question is regarding how soon can we apply or how do we, just give me a second. What time will the plan be implemented and be accessible? So I think the question is more with respect to how faster we can be implemented and how fast we could apply.
Sure. I mean, I think as I previously said, the applications are open. The details, if everyone can see, is on the screen and will be shared to everyone right after this by the organizers. 25th October is the last date. 27th September is the last date, and 25th October is when the finalists will be selected. And we hope to onboard all of them through this platform by first week of November. And depending how the COVID situation is and the requirements of specific startups, you may or may not, utilize our incubation space at AIIMS Jodhpur or our NASCOM center in Bangalore. But the idea of actually virtually onboarding everyone, right? That's the new normal now, would happen by the first week of November. But if you're interested and you seem interested, go ahead and apply today.
Thank you. Amrit, there's another question. If you could answer this, what disease areas are we trying to address through this?
Okay, so I would say that as was reflected in the problem statement, we are actually touching upon almost throughout all therapies, as you would have read. And I think the thinking is more to have the continuum of care approach with the patient at the center, as Dr. Kuldeep was saying. So nevertheless, it's always good to have some focus. So of course, we do have a focus broadly. So while for many of the challenge areas in the problem statement, we are inviting applications for all therapy areas or a wider kind of gamut. Some focus that we have defined is within the area of NCDs, specifically the respiratory, metabolic, oncology, and diabetes, etc. So that we do have some specific areas called out in the problem statement. So I would encourage you to kind of read the problem statement on our website to really understand for specific statements, which are those applicable therapy areas. And I think in general, I think our thinking is also to kind of see how can we improve healthcare overall. And I think as Dr. Kuldeep alluded, the current COVID situation has kind of pushed it. So we are very keen to see, while some things were very obvious in the past, what are those technologies that can get adapted quicker because of the push that COVID has given us. And I will not say to the post-COVID world, because we don't know when that's going to happen, but to this new healthcare world, let's say.
Thank you so much. One question that is generally coming up in all the social media posts is, can an idea be applied? Can an early stage startup or we have an idea, but we don't have a startup yet, can we apply to the innovation challenge? Amrit, you or Shubhang, or do you want to take that question?
Sure. We are inviting startups from the idea stage, mid stage, kind of early stage, late stage, the entire gamut. So of course, feel free to apply even if you are just at idea stage, but try to be as concrete as possible for us to really understand it. Make sure you have kind of thought about it in all ways. Like Dr. Anil mentioned about the advice he gave about how you should think about it and what the kind of how we got the acronym for startups. So please think through the idea before you apply. So you can apply as an individual. Also, you need not have a company. And overall, I think the aim of the India-Sweden Healthcare Innovation Center is to see how to take you from where you are to the next stage. So how do we kind of accelerate that process despite where you are?
Perfect. In that case, those are the questions that we have received till now. If any one of you have any questions while applying to the Innovation Challenge, or if you want to apply to the Innovation Challenge, please feel free to visit the website. And if you have any queries, you could contact in the credentials that are shared to you. We will also share the presentation material along with the details of how to apply to the Innovation Challenge shortly to all of you. So thank you so much for attending the event, and thank you so much for all the presenters who has participated in this event and sharing your valuable opinion. That's it from our side. Thank you so much and have a good day.
Yeah, and we look forward to taking this to greater heights with Atal Innovation Mission. Thank you.
Totally.
Dr. Ramanan and team.
Thank you, Mr. Ramanan. Thank you, Manglesh.
Thank you, Shubha. Thank you, Amrit.
Thank you.
Dr. Anil. Thank you, Dr. Kuldeep.
Thank you, Raman.
Thank you, Anders. Thank you, Harika. Thank you, Jayashree. And thanks to the entire team.
Yeah.
Thanks, everyone. Bye-bye.